Imagine a patient comes to the hospital with a small pimple near the nose. A few days later, a patient develops a swollen eyes, double vision, and cannot move eyeballs. How can tiny infection on the face affect the brain? The answer lies inside one of the most clinically important venous sinuses of the skull, that are the cavernous sinus. If you understand this topic, you will never forget why the dangerous area of the face. And uh, this is the one of the favorite university exam question. Before we memorizing anything, let's answer one question. Why MBBS students care about the cavernous sinus? Because it single connects the topic anatomy, neuroanatomy, ophthalmology, ENT, and clinical medicine. And examiners also love asking the what is cavernous sinus, relation, structure passing through it, and why does cavernous sinus thrombosis occur. Let's see, where does blood from the brain go? Brain has a veins, but unlike veins elsewhere in the body, they don't immediately drain into large veins. Instead, they empty dural venous sinuses. Think of the sinuses as a large drainage channels made between the layers of the dura mater. And imagine your city has many small roads. All the traffic eventually reaches a big highway. Similarly, small cerebral veins leads to the dural venous sinuses, and that leads to the internal jugular vein. So, cavernous sinus is simply one of the important highways that drains venous blood from the brain and the nearby structures. Now let's define it. Cavernous sinus is the paired dural venous sinus and located on the both sides of the body of the sphenoid bone in the middle cranial fossa. That means there are two cavernous sinuses, one right and one left. Each side lies beside the pituitary region. But why it's called as the cavernous? Because when you cut it open, it doesn't look like one large empty space. Instead, it is divided into small venous spaces by the fibrous band called as the trabeculae, giving it a sponge-like and cavernous appearance. This is where the name comes from. Cavern means the cave-like many small chambers. That's cavernous sinus means many venous spaces. Now let's understand where exactly it is. Here is the normobasalis, here is the sphenoid bone. This is the sphenoid bone, and one of the each side of the body lies on the cavernous sinus. According to this, it is present in middle of the cranial fossa and either side of the body of the sphenoid bone. Now another question is how it is formed. The roof and floor and the wall are formed by the endostele layer of the dura mater. Endostele layer of the dura mater and lateral wall is formed by the meningeal layer of the dura mater. Roof and the lateral wall. Students often confuse these walls in exams, so remember roof and medial meet the endostele layer. Roof and medial, floor and medial, meet the endostele layer. Cavernous sinus is relatively small. According to this, its length has 2 cm and width is 1 cm. Now comes the most important point. Instead of mugging up 6 relations, let's imagine the cavernous sinus as a small room. Every room has 6 walls. Similarly, cavernous sinus has surrounding structures on every side. Superior relation, above it lie optic tract, optic chiasma, olfactory tract, internal carotid artery, and anterior perforated substance. Now think, why are these structures important? Because diseases involving the cavernous sinus can affect nearby visual pathways and producing visual symptoms. Inferior relation. Below the cavernous sinus lies the foramen lacrum, also nearby the junction of body and greater wing of sphenoid bone. Now move your finger toward the center. The middle relation is to pituitary gland, means the hypophysis cerebri, and sphenoidal air sinus. Now ask yourself, why is this clinically important? Because the surgeons are approaching pituitary gland through the nose and must work very close to the cavernous sinus. A small mistake can injure major nerves and vessels. Lateral relation. Laterally lies the temporal lobe of the brain, simple enough. And anterior relation. The cavernous sinus reaches the superior orbital fissure and close to the apex of orbit. This explains why infections affecting the cavernous sinus can produce the eye symptoms. Posterior relations. Posteriorly, it related to the apex of petrous part and petrous part of the temporal bone and crus cerebri of the midbrain. Again, just don't remember, visualize the sinus sitting between these important structures. These are the cavernous sinuses, pituitary gland. If you can draw this rough diagram in exams, remembering the relations much more easier. So imagine a cavernous sinus as a tunnel filled with venous blood and some important structures travel inside the tunnel. Others travel embedded in the lateral wall and protected by the dura mater. And simple concept explains almost every clinical feature of the cavernous sinus thrombosis. Lateral wall of the cavernous sinus. There are four structures arranged in the above to below. Let's see. First one is oculomotor nerve. This is the nerve that supplies most extraocular muscles. And why should it be near the orbit? Because its destination is in eye. It enters the orbit through superior orbital fissure. Second one is trochlear nerve. Just below the third cranial nerve lies the trochlear nerve and supplies only one muscle, that is superior oblique muscle. Although it's small nerve, injury causes vertical diplopia and especially while walking downstairs. Third one is ophthalmic nerve, divides into lacrimal, frontal and nasociliary nerves. And again it enters the orbit through the superior orbital fissure. Next one is maxillary nerve. Finally comes the maxillary division of the trigeminal nerve, and it is also sensory nerve. But notice something different. Instead of entering through the superior orbital fissure, it leaves the skull through the foramen rotentum. And this is one of the favorite university viva questions. Which nerve in lateral wall does not pass through the superior orbital fissure? The answer is the maxillary nerve. Here is the one memory trick from above to downward, that 3, 4, 1, 2 means cranial nerve third, cranial nerve fourth, and first branch of fifth nerve and second branch of the fifth nerve. Very easy. 3, 4, 1, 2. These are branches of 5. 3, 4, 5, 3, 4, 1, 2. Structure passing through the sinus itself. Let's begin. First one is the internal carotid artery. Why would the artery pass through the venous sinus? Because internal carotid artery is carrying oxygen-rich blood to the brain. Its route naturally passes through the cavernous sinus. Around this artery lies sympathetic nerve plexus. And remember this association, internal carotid artery plus sympathetic plexus. Second one is abducent nerve, running just infrolateral to the internal carotid artery. It is the abducent nerve. It supplies only one muscle, that is lateral rectus muscle. Its job is simple, that it abducts the eye. Whenever you look sideways, you are using your lateral rectal muscle. Why is the abducent nerve inside our sinus? It is because the abducent nerve has a straight central course toward the orbit, and it passes directly through the venous sinus instead of taking protected lateral wall route. And this has the important consequences, since it is the floating inside the venous blood and it is the first cranial nerve affected in the cavernous sinus thrombosis. That's why the patients first develop failure of the lateral rectal muscle and eye cannot move laterally, horizontal diplopia. If examiner asks which cranial nerve is first affected in the cavernous sinus thrombosis, answer is the cranial nerve 6, that is the abducent nerve. Here we will see in the diagram, these are these oculomotor nerve, trochlear nerve, internal carotid artery is here, ophthalmic nerve and abducent nerve. Here is ophthalmic, here is abducent, and it is the maxillary nerve. We have seen here, it is the pituitary gland. Let's see about the next part, tributaries of the cavernous sinus. Think, a cavernous sinus is a central railway station. Many veins bring blood into from the different directions. Instead of memorizing the list, we divided it into 3 groups. Orbit sends blood through superior ophthalmic vein, inferior ophthalmic vein, and central vein of retina. Why do these veins drain into the cavernous sinus? Because the eye and orbit requires continuous venous drainage, and cavernous sinus act as their main collecting channel. This is why the infection around the eye can spread directly into the cavernous sinus. The veins from the brain. So now blood comes from the brain through the superficial middle cerebral vein and inferior cerebral veins from the temporal lobe. These veins collect the blood from the lateral surface of the brain and empty into the cavernous sinus. Third one is veins from the meninges, from the spinoparietal sinus and frontal branch of middle meningeal vein. Now blood has entered the cavernous sinus, but where does it live? Again imagine the cavernous sinus as a traffic junction. Again blood exists through the different pathways. First one is superior petrosal sinus. Here one pathway is the superior petrosal sinus, carries blood towards the transverse sinus. Second one is inferior petrosal sinus. Another pathway is inferior petrosal sinus, and this drains directly into the internal jugular vein. This is the major route by which blood finally leaves the cranial cavity. Third one is the pterygoid plexus of veins. Now here's something interesting. The cavernous sinus also communicates with the pterygoid venous plexus through the emissary veins. Ask yourself why it is important. Because emissary veins have no walls, that means the blood, unfortunately, infection can occur, and this is one of the most important clinical concept in the anatomy. Fourth one is the facial vein. Cavernous sinus also communicates with the facial vein through the superior ophthalmic vein. And now picture becomes clear that imagine someone squeezes an infected boil near the nose. Bacteria can travel the face to the superior ophthalmic vein and to the cavernous sinus and causes the cavernous sinus thrombosis. Now you can understand why the area around the upper lip and the nose is the dangerous area of the face. This is not just anatomy, this is the anatomy behind the real medical emergency. Fifth one is the communication between right and left cavernous sinuses. Through the anterior intercavernous sinus, posterior intercavernous sinus, and basilar venous plexus. This means an infection starting on the one side of can easily spread to the opposite side. Here is one tip that students often forget: the basilar venous plexus. Don't miss it in the university exams. Why the infection spread so easily? Now let's answer the biggest why. Why does the infection spread so rapidly through these veins? Because almost all the venous communications are the wall-less. Unless veins in the limbs, these veins do not have walls to prevent the backward flow. So blood can move in either direction depending on the pressure changes. This is why facial infection, nasal infections, and paranasal sinus infections can spread into the cavernous sinus, and this single concept explains one of the most famous clinical correlation in anatomy. Here we will see the factors helping blood flow from the sinus. Expansile pulsations of the internal carotid artery. Remember, the internal carotid artery runs inside the cavernous sinus. With the every heartbeat, the artery expands slightly. This pulsation helps move venous blood forward, and think it is as a tiny internal pump. Here, second one is the gravity. When you are sitting or standing, gravity assists the venous drainage. Third one is position of the head. Changing the position of head also influences venous outflow. Simple concept but commonly asked in Viva. Next part we will see what is the cavernous sinus thrombosis. Let's imagine a patient. Young man squeezes the infected boil on the upper lip. 2 days later he develops severe headache, fever, swelling around the eyes, and double vision. What happened? The bacteria travel through the wall-less facial ophthalmic veins into the cavernous sinus. Inside the sinus, infection causes the inflammation and formation of the blood clot, that is the thrombus, and this blocks the venous drainage and compresses the nerves passing through the sinus. What is the, and this is that the cavernous sinus thrombosis. Here is one exam tip that it is the favorite university question. They mention the causes of cavernous sinus thrombosis. These are the common causes that are the sepsis in the dangerous area of the scalp, face, and infection of the nasal cavity, and infection of the paranasal air sinuses. Why do symptoms occur? Why does this disease produce both nerve symptoms and vein symptoms? Because inside the cavernous sinus we have one cranial nerves and major veins together. So thrombosis affects both. That's why the symptoms are divided into nervous systems and venous symptoms. Let's understand the nervous symptoms. First one is severe pain. The patients complains the severe pain around the eyes and forehead. Why? Because the ophthalmic division of the trigeminal nerve it is irritated. And remember part 2 that second one is the paralysis of the eye muscles. Now comes the most important concept. Inside along the wall of the cavernous lining lie oculomotor nerve, trochlear nerve and abducent nerve. When thrombosis compresses these nerves, the muscles may supply becomes weak or paralyzed and the eyeball cannot move normally. Patient develops restricted eye movements and double vision diplopia. Which nerve is affected first? That is the abducent nerve. Why? Because it is lies inside the sinus and directly surrounded by the venous blood. That other nerves are relatively protected in the lateral wall. It is the high yield viva question. The cranial nerve first affected in the cavernous sinus thrombosis, that is the abducent nerve. Let's see the venous symptoms. Now let's understand the venous symptoms. Remember the orbit drains into the cavernous sinus through the ophthalmic veins. If the cavernous sinus is blocked by the thrombus, where will blood go? It cannot drain, so blood accumulates inside the orbital veins and this causes the venous congestion. Now everything becomes easy that edema, according to this the patient develops marked edema, eyelids, cornea, root of the nose. Why? Because venous blood is trapped, fluid leaks into the surrounding tissues. Exophthalmos. Now ask yourself that if blood accumulates behind the eyeball, what will happen exactly? The eyeball is pushed forward, called as the exophthalmos protrusion of the eyeball. Pulsating exophthalmos. Why? Normally, the internal carotid artery passes through the cavernous sinus. After severe head injury, abnormal communication may develop between internal carotid artery and cavernous sinus, and this is called as carotid cavernous fistula. And now arterial blood enters the venous sinus under high pressure. The pressure is transmitted to the orbital veins. As a result, eyeball bulged forward and because arterial blood pulsating, protrusion eyeball also pulsates. This is condition called as pulsating exophthalmos. Here are the rapid revision. Causes for thrombosis, that are the dangerous area of the face, nasal cavity infection, paranasal infection, nerve symptoms, eye forehead pain, and third, fourth, and sixth nerve palsy, diplopia, lateral rectal affected first, that is abducent nerve, venous symptoms that eyelid edema, corneal edema, root of nose edema, and exophthalmos, pulsating exophthalmos due to carotid cavernous fistula after head injury. So we have learned all about the cavernous sinus. Here is the final diagram for you. This is the pituitary gland. These are the internal jugular carotid arteries. These are the nerve in the lateral wall. Abducent nerve in the middle. These are nerves are supported by the lateral wall, but it is the first affected by the cavernous sinus thrombosis. This is the cavernous sinus in the normobasalis. Inferior petrosal sinus is here and superior petrosal sinus is here. Inferior petrosal sinus and superior petrosal sinus. It is the cavernous sinus and circular venous plexus is here. So we have learned all about the cavernous sinus. If you like it, share, like and subscribe. Thank you.